So apparently I'm just standing here. Okay, no problem. So let's start our lecture for today. It's about maternal fetal child health. Anyone knows what is maternal health? Yes, please. Can you raise your voice and say your name, please? Abdurrahman, yeah. Excellent. Maternal means related to the mother. Okay. What else? Do you have any other idea? Anyone else? Yes? During birth. Very good. So only when she is giving birth. Okay. Yes, you. Pregnancy. Very good. Okay. What about fetal? Fetus. What is fetus? Unborn baby, right? When he is inside the uterus, right? Okay. And child, you know what is child. Perfect. So let's move on. So today, I will be talking only about maternal health. Next week, I will be talking about fetal and child health, okay? So today you will understand what is the meaning of maternal health, maternal mortality, maternal morbidity, and then I will talk about the medical causes that cause usually maternal mortality, and then I will talk about also the determinants of health for maternal health. After that, also, I will talk about WHO, World Health Organization recommendations on antenatal care for a positive pregnancy experience. And then I will touch base on the different family planning methods. I will definitely talk about the vaccinations during pregnancy and postnatally. All right? Maternal child health. Okay. Who would like to read that one? But please use the microphone. Someone from there? Anyone? From this side? Yes? Can you use the microphone? Read that slide?
Maternal and child health refers to the health status and health services provided to women and children.
Yes, please.
MCH indicators are often used to measure the social, economic, and educational status of women as well as community-level access to primary care. There is a large disparity in MCH indicators between high and low-income countries. Remarkable achievements have been made in reducing child and maternal mortality and morbidity.
Excellent, thank you. What's your name?
Sidra.
Sidra, okay. Thank you, Sidra. So you can see that maternal and child health usually is about the health of the mother and the baby, all right? The mother while she is pregnant and even when she is giving birth and after giving birth, okay? So maternal health is 3 phases: when the mother is pregnant, when she gives birth, and after giving birth, all right? Fetal, it means the health of the fetus, which means unborn baby. Okay. Actually, there are some indicators that might tell you about the health of the mother. And those indicators usually measure the social, economic, educational status of the woman, as well as community-level access to primary care. So what do I mean by this? Anyone from there? Unfortunately, I cannot move that much. Anyone? Indicators. Indicators means something that show that the mother has a good health or not. And those indicators depend on the social, economic status, educational status of the woman. So if the woman is well educated, this will tell you what about her health? During pregnancy, I mean when she becomes pregnant, is she gonna be her health is gonna be not good, or she's gonna be in a good health while she becomes pregnant? Good health. Why good health? Because the mother is educated, she knows what to expect during pregnancy, during delivery, and she will take care of herself, right? The same as community level access to primary care. People who has easy access to primary care, okay, those women are usually have a better maternity or a better pregnancy period, okay? There is a large disparity in MCH or maternal and child health indicators between high and low income countries. And I think that Dr. Bara has already explained about that. There is a large disparity in the indicators between high and low income countries. Low income countries means what? People are poor, right? Or not, of course, not all of them. This also means that people might become less educated. Women might become, or economic status will not let the woman go to visit their primary health care that often, right? So that's why pregnancy advices and the mother's health during pregnancy might become affected, okay? Of course, throughout the previous 100 years, remarkable achievements have been made in reducing child and maternal mortality and morbidity. So let's talk about some statistics here. Every year, and those are taken from the Cross and Red Crescent societies, 350,000 women die in a pregnancy or childbirth. So although there were remarkable achievements in reducing mortality and morbidity of the mother, but still we have per year around 350,000 women who die while they are pregnant or when they give birth, okay? I will explain to you about what is the meaning of maternal mortality and morbidity later on, all right? But for now, just a hint. Mortality means death. Morbidity means disease or sickness. All right? So although there were remarkable achievements in reducing the death of the mother while she's pregnant and giving birth, and also reducing the diseases and sickness during pregnancy, we still have 350,000 women die in pregnancy or childbirth. 7 million or 7.5 million children die before reaching their 5th birthday. We will talk about this in next lecture. 40% die in the first month of life. Do you have an idea? I will talk about that next lecture. But do you know any reason for babies to die during their first month? Yes, please. Syndromes, you mean malformations or abnormalities or something like this. Okay, perfect. What else? Very good. Malnutrition. In low-income countries, of course, they might die because of malnutrition. Yes, please. Community? Immunity. Okay, yes. Excellent. Yeah. What? Premature. What is premature birth? Very good. Excellent. I will talk about that. Premature birth means babies delivered before full term. Okay? Yes. Accidents or trauma. What else? Something very, yes, very common. Diseases, yes. No access to health care. Excellent. What else? Infection. Perfect. So it's very common for babies to get infected during pregnancy. And this usually infection comes sometimes from the mother, sometimes from the environment, sometimes from the baby beds, okay? So this is a very common reason for the death of babies when they are 1 month old. Okay, let's go back. About 6 million deaths could be prevented. Can you believe that? We have around 7 million children die before reaching their 5th birthday. 6 million out of these can be prevented. I'm not so happy about those people who are sitting there. Is there any chance that you can be a little bit here or no? Because of social distancing, I understand that, but please just to interact with me. I promise next week I will try to get the other microphone and thank you very much. Okay. Missed something? No. All right. So here, maternal health. We have different definitions here. Maternal health, maternal morbidity, women's health. So what did we say about maternal health? What's the meaning of maternal health? Anyone from here? Yes, please.
Yeah, that's making my life much easier. Thank you. Okay, perfect. So, maternal morbidity means when mother becomes sick while he is pregnant and or when she gives birth or after giving birth. Okay? Women's health. What is women's health? It's very easy. Very easy. Women's health. What's the difference between women's health and maternal health? Okay, let's take someone from here. Anyone from the back? What is women's health? Here, people. Hello? Your friend beside you. He's not even looking. Hello? Yeah, you. What is women's health? You. Yes. Yes, what is women's health? You don't know? Try anything. There's no wrong or right today. Only in the exam. What is women's health? General for men and women? Oh my God. Okay, yeah. Very good. So does the woman's health include maternal health? Of course, yes. So women's health means, as your friend said, the general health of the woman, and also it include the maternal health. Okay? So it's the health of the woman throughout her life and throughout her phases, and it's just the general health. Okay? So let's move on.
So this is just a short video. Would you like to watch it? Or you will watch it? Okay. Inshallah it will work. I'm not really sure. Very nice. So what did you understand from this video clip? Any idea? What did you understand? A shocking information? Yes? Yes, please.
That most maternal deaths occur in developing countries, and that 99% of them are preventable.
Excellent, Farah. So, as Farah said, that unfortunately, most of the maternal death happen in developing countries. Actually, 99%, and this is a very shocking percentage. And do you think it can be prevented? How can be prevented? Any suggestions? Yes, please. Very good. So, improve the health care. What else? Yes. Educate women. Excellent. Who else? Any other suggestions? How can we improve maternal health, especially in developing countries? Yes. Regular checkup. So basically, improve the healthcare system, improve the education of the mother, and also raise awareness. Right? Right or no? Oh, very good. Yes, please. Money and knowledge. Wow. Yeah. So, as your friend said, short term is money and knowledge. Very good. Okay.
So, maternal mortality. Maternal mortality or death, as I said, is the death of the woman while she's pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Did you understand anything from this? It's a very long sentence, I know. Did you understand anything from it? Yes. What? Very good. Excellent. So, but let me start with the first sentence. Maternal mortality or death is the death of the woman while she's pregnant or within 42 days. Within 42 days of termination of pregnancy. What do I mean by termination?
Yes. Abortion. Only abortion? Miscarriage. Only miscarriage? After giving birth. Termination of pregnancy. You terminate the pregnancy either full-term pregnancy, premature pregnancy, miscarriage, abortion, whatsoever. Termination of pregnancy. Irrespective of duration, it doesn't matter. Even after 1 month, 2 months, it's maternal death. At any time the woman died while she is giving birth, at any time that the woman died while she's pregnant, it means it's maternal death. Even after 1 month, if they're after 2 months, or when she gives birth, whether she miscarry, whether she abort, whether she have a full term, all right? So irrespective of the duration and site of pregnancy. What site of pregnancy? What other sites? What kind of sites do you know for pregnancy? You raised your hand? No? Anyone from here? Site of pregnancy. Have you ever heard about pregnancy in the ear, in the eye? Yes? Ectopic, very good. So what is ectopic pregnancy? Yes? Excellent. Outside the uterus. Where outside the uterus? In the tube, in the fallopian tube. Very good. It might be in the fallopian tube, and sometimes it's also in the peritoneum, very rare cases. Sometimes in the cervix. Okay, you know the cervix, right? The neck of the womb, the neck of the uterus, right? Okay. So, irrespective of duration and site of pregnancy, whether the mother had an ectopic pregnancy or a normal pregnancy inside the uterus. Anytime the mom, unfortunately, died when she's pregnant, whatever the pregnancy is, and whatever the outcome of a pregnancy is, this is maternal death. Very good. So, from any cause related or aggravated by the pregnancy. So, any cause related to pregnancy, such as bleeding. If the woman bleeds while she is pregnant, if she has a placenta that it's not in its place, that we call it placenta previa, then the mother bleeds sometimes heavily, okay? And this might cause death of the mother, okay? Sometimes what happens is an early separation of the placenta, and that's what we call placenta abruption, okay? And unfortunately, there are some mothers who really bleed very heavily and they die because of this. Okay. There is another thing. What about aggravated by pregnancy? Aggravated by pregnancy means the mother has a disease from before and pregnancy makes it worse. All right? Like some mothers, they have cardiac disease sometimes, heart disease or cardiac disease, and this might become aggravated and become worse during pregnancy and unfortunately might cause death. Okay? So, from any cause related or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Like your friend said, not from accidental or incidental, it means, what if mother gets hit with a car while she's pregnant? Do you consider it a maternal death? Do you consider? No, because it's not related to pregnancy and it's not even aggravated by pregnancy, right? So any accident happens to the mother and she is fully healthy and cause her death, it's not considered maternal death. All right? Very good. So, based on this, we have two types of maternal death. Direct maternal death, indirect maternal death. Direct is the death resulting from an obstetric complications of pregnancy. As I said, like placenta previa, like placenta abruption, like sometimes infection. The mother has sometimes kind of infection and it causes sepsis, and this might cause her to die or might cause death. Okay, this is the direct. Anything related to pregnancy by itself, it is direct maternal death. What about the indirect? Indirect, as I said, it is when the mother has a chronic disease before becoming pregnant, and then pregnancy makes it worse and causes death for her, such as cardiac disease. Very good. We have maternal mortality rate. This is actually for statistical purpose, we have this formula, which is maternal death divided by live birth multiplied by 100,000. Why is it important to have such kind of formula, or why do we need to calculate maternal mortality rate? Why do you think so? Yes? Very good, excellent. So your friend was saying it's just to know if we need any action, right? If there is a high mortality rate, then there is something wrong with the community and we need to improve it, right? Okay, very good. So let's move on. Yeah. Anything is not, if it's not related to. Meaning if she she has a disease or she has an obstetric complication, but it's not causing her death. But she got, no, it's not maternal death. Maternal death, it has to be caused by the obstetric reason, by the reason related to pregnancy. Even if she has like cardiac disease, but it's stable, but unfortunately she got hit with a car and she died. This is not maternal health, not maternal. Yeah. Mm-hmm. Yeah. Yes. No, still it's not maternal. Whenever an accident happens, even if she has like a disease from pregnancy or before pregnancy, but her death is not related to that disease in specific, it's not maternal. Okay? So let's move, yeah. Unfortunately, I can't hear you. Yep. Still not maternal death. If she was a normal woman, and maybe she wouldn't have died of that, you mean? If she didn't have that disease, yeah, maybe she could. But still, the death by itself, I mean, the cause by itself is the car hitting her, even if she is normal or not normal. Okay, even if they couldn't like treat her because she has that disease, but even if the actual cause is the car, this is the actual cause, no matter what disease she has, or if she is healthy. If she has a car accident, if she is healthy or not, and they couldn't treat her because she had that disease, still, it's not maternal death. All right? Okay. So let's talk about the statistics a little bit here. 99% of all maternal death, as we said, the shocking information that it occurs in developing countries. Maternal mortality is higher in women living in rural areas and among poor communities. And do you know why? Do you know why? Maternal mortality is higher in women living in rural areas and among poorer communities. People from here who would like to, why maternal death occur more in people who are living in rural places? Yes, please. Your name first. Maha? Yeah. Very good. Maha said because the healthcare system is not well developed in rural places. What else? Yeah. Sorry. Oh, okay. So your friend is saying because maybe she will give birth at home, which is related to cultural practices. Very good. So what transportation? Sometimes rural places do not have that much of clinics, right? So, and they don't have transportation. And this is also makes the people or the women with worse health than the woman who is not living in rural places. Yes, please. Awareness. They are not aware about the pregnancy, what to do, what they should do once they are pregnant. Yes. Yes. No medications. Excellent. You have another things? Yeah. Yeah. Economic problem. Very good. Any other thing? Okay. So, as your friend said, maternal mortality is higher, of course, in women living in rural areas and among poorer communities because of lack of health system, lack of transportation, because of cultural practices, because of lack of money, and they don't have enough money to go to clinics, right? Okay. Young adolescents face a higher risk of complications and death as a result of pregnancy than other women. That's absolutely right. Do you know why? In other terms, teenage pregnancies might face a higher risk of complications and death than the other women. Do you know why? Like women below 18 who become pregnant, they are at higher mortality and morbidity. Yeah, let me take from the voice section here. Any idea? Yes, please. Your name? Samar. Yes, Samar. Very good. Excellent. So their body still not prepared to become pregnant. What else? Very good. Excellent. Yes. Very good. They are young and less educated. They don't have that much awareness about pregnancy, what should they do, why they are pregnant, and other things. Yes. Very good. The hormones also are not stable. There is another thing also. This is based on the statistics that taken, of course, from the Western countries. Also, those outside the, like in developed countries, they are more to become drug abusers, or they smoke or something, and this might affect their pregnancy. So it's at the end, it's lack of awareness and lack of education. Okay. Between 1990 and 2015, maternal mortality worldwide dropped by about 44%. Excellent. So, why? Why do you think maternal mortality dropped that much between like 1990 and until now, recent years? Yes? Very good. What else? Very good. Yes, what else? You? Yeah. Yes, you. Medical advancements, excellent. Okay. So let's move on. Let's have a look on medical causes. I will not go into too much explanation about the medical causes because you will take it, inshallah, after the 4th year. So medical causes, the main medical cause of maternal mortality is hemorrhage.
Hemorrhage. You know why hemorrhage? Or do you mean, do you know what's the meaning of hemorrhage? Bleeding. Hemorrhage, bleeding. And of course, there are mild bleeding, there is moderate bleeding, and there is severe bleeding. And here we are talking about the severe bleeding that cause woman's death. The other one is having hypertension, okay? And then the second is hypertension and indirect. You know what is the meaning of indirect cause? The woman had already a disease before becoming pregnant, like cardiac disease, like renal failure, like what else? Liver cirrhosis, okay? So any indirect cause, I mean, not related to pregnancy by itself. This is the second cause with hypertension to cause death for women. Okay, so I want you just to know the first killer or the first cause that might cause maternal death and the second ones only. How about broader determinants of maternal mortality and morbidity? Sorry, there are a lot of R's, determinants and mortality, morbidity, so I'm not pronouncing it correctly. Okay, so let's talk about the determinants of maternal mortality and morbidity. First one is individual non-medical risk factors. So what do I mean by that? Age. What do you think? What are the age that might put a woman at high risk of morbidity? Yes, please. Above 40, excellent. So above 40 and below below 18. Above 40 and below 18. Parity. Any idea what parity means? Parity? Yes? Can you raise your voice with it?
Number of pregnancies. Parity, number of pregnancies. So which parity will put a woman at higher risk of morbidity? More than? Can you cheat like this? Three. Okay, so actually we consider a high risk pregnancy when the woman is or have more than 3 pregnancies. Okay, more than 3, not 3, more than 3. Okay, this is a high risk pregnancy, and there is a very high risk pregnancy which is more than 5. So more than 3 is considered a high risk pregnancy. I don't want to go through details, but I will just give you some hints. This is because the woman will be at higher risk of having hemorrhage, higher risk of having DVTs, deep venous thrombosis, and will put her at risk of even uterine rupture. So the other causes, but don't worry about that. It's just I want you to know that age, when the woman is above 40 or the woman is younger than 19, when she has more than 3 pregnancies, this is considered a high-risk pregnancy. Unintended pregnancy. Unintended means the woman who does not go and follow up with her primary health care practitioner or even an obstetrician. Women's and husband's education, the education in general, you know. Obesity, also this is considered a high-risk pregnancy, and personal hygiene. Personal hygiene, you know what's personal hygiene. They don't take care of their personal hygiene that much while they are pregnant, and sometimes they might get a serious infection. Okay? Socioeconomic status. So the first determinant of maternal mortality and morbidity is individualized risk factor. All right? The second one is socioeconomic status. Women who are less educated, they are poor, who has malnutrition, or of course in conflict areas, which means war zone areas. Environmental, the third determinants of maternal mortality and morbidity is environmental issues. Like in some areas the water is not clean, there is pollution. This is also will put a woman at high risk of having a morbidity or mortality. Transportation network, like I said, in rural places, sometimes clinics are not that much available. So the woman, in order for her to get her follow-up appointment or to go to her doctor, she needs a transportation, and sometimes this transportation network is not available. So this is the fourth determinants of maternal mortality and morbidity. I'm not talking here about medical causes. I said about the medical causes. No, now we're talking about determinants of maternal mortality and morbidity, and this is based on public health point of view or perspective. Okay, so those regarding to public health perspective. Health system, as we said, the number of health system, quality of care, distribution of staff members, this affects as well the mortality and morbidity of the woman. Yes, please. Yeah, of course it's a high risk. Miscarriage, it has different definition, different types, and different, So we will not talk about miscarriage because we will go through details. The parity means the pregnancies, number of pregnancies. Yes, if she miscarried, it means it's a pregnancy. I mean number of pregnancies, not number of children. Okay. More than 3 pregnancies, this will put her into high risk pregnancy. Okay. Clear until now? Any questions? Okay. In 10 minutes, I will give you, if you want, a break. Maternal mortality in Saudi Arabia between 1990 and 2015, you can see that in 1990 it was around 46 per 100,000 live birth, and the good thing now in 2015 it's at 12 per 100 live birth, and for now maybe it's much less, but I don't have actually the statistics and I couldn't find it. Okay, so how can we prevent maternal death? What do you think? As we said, most maternal death is preventable. How do we prevent maternal death? Can anyone summarize it to me? Money and knowledge? Who said that? Money and knowledge? You, right? Not you. Guys, the one who's, why are you not saying me? Or you're sleeping? You're sleeping? Oh my God. Yes. Very good. Equality. So equality, your friend, what's your name? Smile. Smile is saying that it's the equality between poor and rich people in order to reach the medical care that is needed, and also is saying about the education and awareness, right? Do you have anything else to add? Yeah. Excellent, and having access to healthcare. So shortly, it's raising awareness, improving education, improving the health system, and as well to have equality between the poor and rich people. Okay? So actually, most maternal deaths, as we said, are preventable. As the healthcare solution to prevent or manage complications are women. To avoid maternal death, it's also vital to prevent unwanted and too early pregnancies. All women, including adolescents, need access to contraception, safe abortion services to the full extent of the law, and quality post-abortion care. This is a very important point. To avoid maternal death, we have to avoid unwanted pregnancies. Sometimes the woman has 3 children, 2 children, and she doesn't want right now. I mean, because like her older child is 4 years old, the other one is 2 years old, and she doesn't want now any more children and she wants to postpone. Okay? This is very important in this case to tell the woman about how to postpone the other pregnancies. So, in order to avoid maternal death, it's very important to postpone the unwanted pregnancies, to postpone the pregnancies, What does that mean? It means that to give her contraceptions, and I will talk about that later on. Okay? And to have, of course, safe abortion services. Safe abortion services based on medical reasons, not based on individual opinion or something. Okay? So, safe abortion services based on medical reasons. What do I mean by based on medical reasons? If the woman is, for instance, pregnant with a baby who has morbidities that's incompatible with life, then we can give her the right to abort. Okay? Because otherwise, the woman will go through a pregnancy which might complicate it with many things, and also she will go through delivery and it might be hard for her. So all these reasons might cause unsafe termination pregnancy. Okay? So it's very important for us to avoid maternal death is to prevent unwanted pregnancies and also to give the woman an access to contraception and safe abortion services based on medical reasons. Okay? So let's move on. What are the barriers to access to health care? First one is poverty. Poverty is the first barrier to access to health care. All right. The other one is the distance. As I said, people who are living in rural places, they might not have transportation to facilities or to healthcare facilities. The other thing is lack of information, which means lack of awareness. Fourth, inadequate services, like also again in rural places, there might not be that much of clinics, so the woman has to go for around an hour or 2 in order to reach to a healthcare facility. And then cultural practices. As your friend said, that sometimes the women, especially who are in rural places, might favor to have a home birth by a midwife than going to the hospital and have a delivery there. Okay? What else cultural practices do you know? Yes. Sorry? Oh, very good. So sometimes women tend not to have a birth if the doctor who's going to deliver her is a male. But this is based on her personal wishes and we have to respect it. Okay? Cultural practices, like some women, especially who lives in rural places, the one who would like to take care of them is a midwife. And the midwife actually is not a midwife, a real midwife. She is not certified. Midwives now, they go to college, they study, they have a certificate to practice, but the older midwife, I don't know about those midwives who just like to boil water during giving birth. I don't know what do they do with the boiling water and a lot of towels, and they just deliver the woman. But do you have an idea why do they boil the water? And many towels, yes. Yes, to expand and, and explode for the uterus. Yes, yes. Well, for me, I don't know why do they boil that much of water. So this is just the cultural practices, you know. So, but unfortunately, that might cause also sickness to the mother, infection and stuff. So this kind of cultural practices should not be practiced anymore. Okay, so there is a big difference between the midwife before, whose name was like I don't know, Angela, or something. I have no idea. And between, of course, the midwife nowadays who goes to college and they are READ certified and they might be even better than obstetrics, but this is a little secret. Okay, طيب. So let's move on. So what are the WHO solutions for this? One of the public health measures to prevent infant and maternal mortality is to advocate for antenatal care in primary care clinics. So it's very important to have actually an antenatal care unit in a primary health care. Okay, so primary health care, you know, it's the first contact for the people in a healthcare facility, right? Isn't it? Agree or not? Okay, good, I have a yes. Okay. So it's very important to have also an antenatal care unit in a primary care clinic. So public health approach in this regard focuses in two groups. Pregnant women in general, who are the low-risk women. It means low-risk women, that the women who do not have any disease or anything, they are absolute. Those are the low-risk women. We have another category, which is men. High-risk women are the poor, young or old, or with medical, the one that, okay, the one that we have explained about, the high-risk pregnancies, right? So it's very important in a primary health care to have an antenatal care unit in order to deal with low-risk women or low-risk pregnancies and high-risk pregnancies as well. Okay. So I will just give you a hint about, okay. I will just talk about antenatal care in primary care. Antenatal care is a type of preventive health care. Its goal is to provide regular checkups and allow doctors or midwives to treat and prevent potential health problems throughout the course of pregnancy and to promote healthy lifestyles and benefit both mother and child. Importance of antenatal care, diagnose medical problems, and might be the only source of education, services, immunizations, and social support, especially for low-income women. I usually let the students read actually the slides, but because of the huge number and the unavailability of the microphone, so I'm just reading, but I will explain. So it's very important to have an antenatal care unit in a primary health care. Why? Why do you think so? As we said, to follow up with the pregnancies, right? And also to diagnose medical problems. Whenever there is a medical problem with a woman, then they can even, either they treat it if they can, if not, then they can refer her to an obstetrician, right? It might be the only source of education. Education about what? Education about what? When the mother is pregnant. Let's talk about lifestyle. Lifestyle changes or lifestyle. What are the three things that is very important to educate the mother about? And it's related to lifestyle. Yes? Sorry? Diet. Very good. Excellent. So it's very important to educate the mother about her diet. What to eat and what to avoid and how much to eat. Yes. Hygiene, very good, excellent. What else? Yeah. Very good. She will talk about diet and weight, how much she should gain. Yes. What else? Exercise. Very good. What about the woman who's smoking? It's very important to educate about smoking, alcohol, drug abuse. Those are lifestyle, also related to lifestyle. So diet and exercise, smoking, alcohol, and drug abuse, and then we have the hygiene, right? Very good. The other kind of education that we should talk to mother about is about immunization. Social support also is very important, especially if the mother is smoking. We can refer her to stop smoking services. And also social services and social support are important for low-income women. They can actually formulate a plan for them to follow up for their pregnancy, and they will include the transportation, they will include the other services needed for the woman. Okay, so social services or social support services is very important to pregnant women, especially those with low income. Okay, so antenatal care, you can see in Holland and United Kingdom, family practitioners provide antenatal care and obstetric services. So it's different between the countries. In United Kingdom and Holland, primary care are the one who usually follow up with the pregnant woman. Okay, this is Holland and United Kingdom. So that's why it's very important to have an antenatal care unit in a primary care facility. Okay? Other countries, like United States and Canada, actually the specialist obstetricians and general practitioners both provide antenatal and delivery services. So in United States and Canada it's a little bit different. The woman can choose to go to a primary health care or she can go to an obstetrician to follow up. Okay? So, principle of antenatal care. Antenatal care actually should be built around the 3 principles. Early, continuous risk assessment. What do I mean by risk assessment? When the mother books her antenatal visit, you should assess any risk that the mother she might have. For instance, she might have diabetes, she might have she might be a smoker, she might have obesity, she might have a mental issue. Okay, it's very important at the booking visit. What I mean by booking visit, when the mother comes for the first time to the antenatal clinic and she is pregnant. Here we have to assess any risk that she might have in order to what? To react upon it, or to to reduce it. Okay, understood? Why you guys see blank faces? You need to, okay, fine. Yeah, go for a break. 9:30, 10 minutes. Okay, but you promise to go back fresh and with a cup of coffee. Okay, yellow. Yeah.
antenatal care. Yalla, hurry up, please. Okay, so we talked about the first principle of antenatal care is an early and continuous risk assessment, and then of course health promotion, and we talked about this by giving her advices on lifestyle changes such as smoking, to stop smoking, if there is drug abuse or alcohol, all of that should be the patient should be counseled about. And also we should counsel her about her diet, her exercise, vaccination that is needed during pregnancy, after pregnancy, and in the future as well. Then the third principle is about medical and psychological interventions as needed. Whenever we know that the mother has a kind of disease, whether mentally or physically, then we should react upon it, and either we give her a referral to the appropriate service or to be treated as at primary care unit. So the ACOG, or American College of Obstetrics and Gynecology, also recommends pre-pregnancy consultation to discuss pregnancy and infant care issues. In addition to the three principles of antenatal care, also there is a recommendation that the woman to have a consultation, which we call it a pre-pregnancy consultation, before become pregnant, in order to discuss any concerns or answer the questions that the woman might have about pregnancy. Okay? WHO recommendations on antenatal care for a positive pregnancy experience. So let's talk about what does WHO recommends in order to have a positive pregnancy experience. The first thing, it's about, okay. So the first thing is about dietary intervention. As we said, the mother should consume healthy diet, restrict caffeine intake to 300 milligrams per day, 1 to 2 cups, not more than 2 cups. The risk is, there is some researchers that say about caffeine intake, especially during the first trimester or the first 12 weeks, that it might cause pregnancy loss, okay? But this is not absolutely confirmed. But the good thing, or what we can do here, is just to advise the mother not to take more than 1 to 2 cups while she's pregnant, especially during the first 3 months. What about supplements and vitamins? 400 microgram of folic acid is recommended in the first 3 months of pregnancy to protect against neural tube defects, and should be started 3 months before pregnancy. I'll talk also about this in details in the next time or next presentation. It's also recommended for the mother to have a daily oral iron after the first 3 months of pregnancy. What about the other minerals or vitamins or supplements like calcium? We don't give calcium to all pregnant women. Do you know why? Calcium might cause constipation, and already the mother is constipated while she is pregnant because of the pressure that the fetus has on the bowel. Okay, so only in some cases, if the mother is confirmed to have calcium deficiency, then we can give her calcium supplements. What about vitamin A? Vitamin A also should be avoided. It's evidence-based that vitamin A cause actually malformations, especially facial malformations and cardiac malformations. Okay, so we should avoid it unless it's proven that there is a deficiency with the mother, or in areas where vitamin A deficiency is public health problem to avoid night blindness. So there are some areas, especially in Africa, which well known to public health, that it is people there are vitamin A deficient. So we should continue giving them vitamin A to avoid night blindness that vitamin A deficiency might cause. Clear? Okay. So if I give you in the exam a question about vitamin A, for instance, vitamin A should, the choices should be given. Vitamin A should be avoided. Vitamin A is not important. What do you choose? No, not important. Avoid it. It should be avoided. Unless I state that should be avoided, for instance, or not important in areas that they do not have a deficiency in it. I mean, I'll be clear, don't worry. It's in my mind now. I cannot formulate it well, okay? But what I want you to know that vitamin A should be avoided. Clear? Okay. Vitamin D, almost in all cases, to protect against osteoporosis. It should be given in all cases. Multivitamins, in some cases, multivitamins, and contrary to what is known here, they give all pregnant women multivitamins. If the woman is healthy and she is eating good, her weight is good, and she's not anemic, and she is very energetic, and so on, so on, so why to give her multivitamins? The less is better when the mother is pregnant, okay? Any supplement or medication should not be given unless needed in a pregnancy. This is a rule, okay? Any vitamin, supplement, medication should not be given to pregnant women unless needed. Fine? Perfect. So let's move on. So this is the first actually recommendation, which is about dietary intervention, and then we will move on to maternal assessment. Maternal assessment includes labs that FBC, full blood test, blood group, Rh type, RBC, hepatitis, infection, some kinds of infection as well. Always be concerned about domestic violence. Always. This is very important to try to investigate about domestic violence, especially if the woman comes to you and she's either tearful or she is not talking well, or you see something like bruises or something. So you have to investigate about it, but you don't have to put any plan. You will just refer her to social services in order to put a plan for her. Okay? Always try to be vigilant about domestic violence. Okay? Because domestic violence put a pregnancy at risk. The mother at risk and the baby is at risk as well. Clear? Clear? Tobacco use. Smoking, what does cause? It causes small for gestational age babies. It means babies smaller in weight and height, or weight and size. Placental abruption, SEDS. SEDS means sudden infant death syndrome. I will talk about that next presentation. Okay? So always offer quick smoking advice, not quite quick smoking advice. Okay, quit smoking advice. Okay? So tobacco use, I might bring you in the exam and tell you might cause so and so and so. Like last year, they said, you did not mention it. I said, no, I mentioned it and it's in the slide. The colors are not to be avoided in the slides. The colors are to be read and understood and memorized. Clear? Okay, very good. As well, maternal assessment should include also alcohol use and substance abuse. Okay? Of course, always ask about past medical and obstetrical history. Okay? So for now, in order for the woman to have a positive pregnancy experience, first of all, we need to do to talk to her, to counsel her about the diet, the supplements. Second thing, we should do a maternal assessment that include lab work, include counseling regarding tobacco use, counseling about alcohol use, substance use, and also to be vigilant about domestic violence, and then to take the medical or any obstetrical history. Okay, what is the third element of the WHO recommendation on positive pregnancy experience? Is about fetal assessment. How can we assess a fetus? By asking the mother, is he moving? And this is usually we do it after the 20 weeks. After 20 weeks of pregnancy, we always ask the mother, whether it's her first pregnancy, second, third, whatever. Ask her, did he start moving? Sometimes it might delay until 24 weeks, okay? At the beginning of 6 months or 7 months, it's fine. But always after 20 weeks, ask about fetal movement. Always listen to the heartbeat, fetal heartbeat, and also do ultrasound for abnormalities, okay? So 3 elements of fetal well-being: movement, heartbeat, and having no malformations or abnormalities. Clear? Okay. So antenatal care in general is about counseling. As I said, it's about counseling about diet. It's about also to counsel. You should always ask the mother, do you feel any symptom? Most of the mother, they might have like heartburn, they might become constipated, they might have nausea, vomiting, low back pain. Always ask the mother and be sensitive and empathetic with the mother, okay? Traveling, sometimes the mother, she will tell you that I need to travel. Give her an advice about traveling. The best time to travel is between after the 12th week and until like 35 or 34 weeks. Okay, always tell her to walk every 2 hours in the airplane. Try to walk or move her legs while she is sitting to avoid any clots or thrombosis. Right? Okay. Counsel the mother about the exercise that she's doing, about the medications she's taking, about immunization, delivery arrangements, where she wants to deliver, and postnatal care. So what about vaccinations? Before pregnancy, live attenuated or weakened vaccines. I will talk about all vaccines in details. The next module is going to be only about vaccinations. So all vaccinations, live attenuated or weakened vaccines like chickenpox, MMR should be given a month or more before pregnancy. So don't give live attenuated vaccines when the mother is pregnant. I will talk about this, I told you, in vaccination. Postnatally, it's very safe to receive vaccines right after giving birth, even while breastfeeding. All kinds of vaccines can be given the moment the mother that gives birth, whether live attenuated, whether it's killed, whether whatever the vaccine is. All right, let me see. Okay, I will only do another 2 slides, then I will, or I can do that. No problem. So during pregnancy, the vaccine, there is a vaccine, it's very important to give it to the mother. It is Tdap vaccine. Tdap is an abbreviation for tetanus, diphtheria, and acellular pertussis. Okay? So 1 dose of that vaccine is recommended during each pregnancy. Each pregnancy, not only in the first pregnancy and then the other pregnancies we do not give. In each pregnancy, we should give this vaccine when the mother is 27 weeks pregnant. Why is that? Because actually, this kind of vaccine will protect the child from a serious infection during the first 2 months after birth. Tdap vaccine usually is scheduled in the child or in the infant vaccination card after 2 months. So in order to protect that infant during the first 2 months, then we have to give it to the mother at the end of her pregnancy in order for the mother to develop the antibodies, and those antibodies goes to the fetus, and then the fetus will keep those antibodies for 2 or 3 months and will protect him from this serious infection. Is it clear? No, I don't think it's clear, right? Clear? Very good. I will repeat anyway the vaccination lecture. Regarding traveling, if pregnant women traveling abroad or at increased risk of certain infection, always recommend other vaccinations during pregnancy, such as hepatitis A or hepatitis B. If the mother is going to areas that has a spread of hepatitis A and hepatitis B, it's okay to give her those vaccinations while she is pregnant. All right? So the main vaccination to be given during pregnancy is Tdap vaccine between 27 and 36 weeks of pregnancy, and also influenza vaccine. Postnatal care, it's all about counseling. Postnatal means after giving birth, 42 days after giving birth. And counseling should include nutrition, hygiene, and also the mother should move as soon as appropriate after birth. We get used to know that the mother or the grandmom of the fetus or the mother of the pregnant woman, she always get used to tell the mom, stay still, be in the bed for 1 week, for 2 weeks. It's okay, it's fine. No, it's not okay. The mother will have thrombosis in her legs, and then it will cause also a lung thrombosis. So always encourage the mother to move as soon as possible after giving birth. Okay, so in order not to have any clots or DVT in her legs, and then she will have a problem. Okay, and it's okay, it's fine to postpone any kind of gathering, congratulation gathering, or anything for after a month is fine. Okay. In malaria endemic areas, mothers and babies should sleep under insecticide impregnated nets. Okay, malaria causes actually a serious infection to the mother and baby as well. In postnatal care, we should include family planning in the counseling, and physiological support should be always given to the mother after giving birth, or even before, of course, giving birth or during birth. Family planning, I will go talk about it next week, okay? Thank you very much for listening.